most famous physical therapist on the internet.
Oh,
We're not even ready. Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heine, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
Today
Bob.
we're going to talk about hand and finger fitness to stop pain and stiffness after surgery, or if you just plain have arthritis.
There you go.
So these are things that unfortunately plague a lot of people.
Right. Particularly, the arthritis thing, arthritis. Kind of like getting gray hairs as you get older for a lot of
it
people.
tends to be part of life,
Yeah.
unfortunately. By the way, if you're new to our channel,
Oh.
please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media and all to our website because we're always giving something away. Right now, what are we giving away, Brad?
The rollers,
We
Bob.
have the foam roller by OPTP, great organization. Go to bobandbrad.com, go to the giveaway section, or you can go to Bob and Brad on Facebook. It will have it pinned to the top of the page. Hopefully we did that. So, all right, Brad, what are we doing here?
Hand, wrist. I just don't like to look at. I know. I was just talking to a friend of mine. She said she wanted to talk to me about some exercises for her hands as they're very arthritic. And actually, mine are too. In the last couple years, I get up in the morning and
You're
I
starting to feel it.
cannot make a fist. And if I force it, it hurts. It's no fun.
Sure.
So you just don't want to get after it in any way. There's a certain method and procedure to go through it. It's not very it's not very hard, but you got to take
You
it.
just need to know it.
There you go.
So,
Or after a surgery, if you've had an injury, a broken wrist, your hand, and you've been in a cast for 6 weeks, you're going to have stiff joints, stiff tendons, and it's the same principle. Either way, you can work this, and either way, you're going to be stiff in the morning when you get out of bed.
and it's really important to understand that actually movement is good for arthritis.
Sure.
The more you get the synovial fluid moving, the more you get the blood flowing, the better it is.
Right.
The only exception I would say is if the arthritis gets so bad that you just don't even want to move the joint. And that's pretty far along. Maybe a rheumatoid arthritis generally,
Sure.
but
Yeah, it's pretty severe, and you probably know it by then.
yeah.
So the first thing you do, when you got that where you can't make the fist and their wrist is stiff, and if you push it, it becomes painful, and just like you don't want to do that.
Yeah, you want to work in the range that it allows you.
Yep. So it's simply, and actually, we're going to start. We call it proximal and go distal in the therapy world. So we're going to actually start in the wrist. Don't worry about the fingers first. Get the wrist moving first.
And you're doing this right away in the morning in bed, right?
In bed before you get out of bed.
Yep.
Yep. Work that back and forth. You can do both hands at once.
So this is flexion and extension of the wrist.
Right. I'm just going to show you one, and do that the best you can, and then you go ulnar and radial deviation.
Yep.
And work that direction. And then you can throw some circles in there, clockwise and counterclockwise. Usually about 10 repetitions of all these will be fine. You'll know. But 10 is a pretty good average for most people. And then you get that wrist moving. Then you go to the fingers, and just a simple close the fist as tight
as much as it'll allow.
Right.
Comfortably.
Yep. You can push it a little bit, then open it, and then close it, and just work it. And typically, the first time you close, maybe get to here, but after about 10 of them, you'll notice it gets a little bit better. But don't worry about getting it all the way tight. Just that's all I want you to do. Then forget about it. Get out of bed. Carry on with your activities of daily living for the next 30 minutes or so, and then come back and do the same exercises again. Work your range of motion, and if they're a little tight, now this time you can actually push a little bit and go to the end range because we want to get that. Do your ulnar and radial deviation.
Yeah, because over time, if you don't stretch it a little bit, you may start to lose the motion, and then it gets worse.
Yep.
So you want to maintain the motion.
And it's going to be a little uncomfortable, but you don't have to push it into sharp pain, but just you
can bump into the pain. You can bump into
it. And again, 10 repetitions each way, and work your circles. It's kind of hard to push the circles. That usually can just works out with after you did the passive range with the flexion and an ulnar and radial deviation. So, and then the fists here.
Sure.
And hopefully by now you've got a little more range, and then you can get in. And what I do is, I have my patients do as well as with myself, I just go over the top and I'll give a full gentle squeeze to see if you can get a full fist. You may or you may not, but more than likely you're going to get more than you did initially in bed. And then when you open it, you just go palm to palm, and you can go this way and this way the best you can. If your fingers are so stiff you're still at this, you haven't created the flat uh, palm to palm. You do the best you can and work it back and forth.
Yeah, that's a great stretch to get all of them at once. And
Sure.
you're getting into extension. And that's the direction you tend to lose.
Right.
You know, it tends to tighten up this way.
Yep.
I might recommend too, Brad, that you might, if you want to work the thumb a little more,
Sure, you bet.
you could go to each finger
Yep.
and touch like that and then reverse.
As a matter of fact, next week we're going to do one on just the thumb.
Oh, you are?
Yep.
I'm sorry. Maybe I'm jumping
No,
ahead
no,
there.
it's good to
Okay,
forecast a little bit.
throw a little
Bob.
thumb in there so
Yep.
that, because that joint is a little different than, you know, it has a rotational component to it
Sure.
where these don't.
The opposing digit.
That's the opposing digit. That's
So
right.
in my case, my third digit, my middle finger, is much more painful, much tighter than the rest of them. I really don't know why. I know I injured it in the past. That's probably why. So I do.
Easy one to jam.
Yeah,
Yeah,
I do
so-
work that one more than the other ones, and I'll go strictly and do the same things and focus on that finger a little bit more. And it's actually developing a trigger finger syndrome. It's kind of interesting.
It is.
Yeah.
And that often comes along with arthritis
Yeah,
too.
yeah. So don't get too concerned about that.
Yeah.
Then the next thing, you want to keep the muscles strong and do something that. So after those first exercises,
yeah.
later in the day, this is what I recommend and works out well for most people, is a ball that's got one of these squishy ones where you can you go into that? It's got the gel inside, and you can work it. I like it because you can work each individual finger. If you have one finger that's more stiff or weaker than the other, you can kind of
Yeah,
get
it's
your
really
thumb in
flexible. You
there.
can get them all. You can work one at a time. And if you have too big a ball, you're not getting weighed down into those
Yep.
intrinsics.
Now this ball works okay, but it's a little bit firm. It's not quite soft, but it depends on the individual. You know,
Yeah,
you
the
got to look
spikes in there
around.
probably don't help either, do they?
Yeah. Well, actually, it feels kind of good. They're not hard spikes.
Oh
They're a
yeah,
little
I guess
soft.
I guess they don't feel too bad.
Yeah, it
Almost
could
like
be.
a little massage.
Yeah, it could be good for you. So, these are just balls that I buy at Walgreens or one of the big box stores. You can go online, you can buy them all over the place, and you can get them for, a
Right.
few dollars a piece. You don't have to get the therapeutic expensive ones, although you can if you'd like to. So,
We're going to mention maybe just one modality, Brad. So, like, if you wanted to, just a simple way to make your hands feel better with
Mhm.
arthritis is called contrast baths.
right,
So, if you have two sinks, you fill up one with water pretty warm to the point where you still can tolerate it, but
right,
it's about as hot as you can tolerate without burning yourself.
sure,
And then the other one is completely cold water.
right,
And you start off, you put your hands in the hot water for like 5
Yep.
minutes, and then you go and put it in the cold water for 1 minute. And then it's back and forth for 1 minute after that. You
Okay.
start with 5, then you go 1, 1, 1, 1,
For
1.
how long?
Well, you can do it for however long I 10 minutes or
So you're gonna go back and forth
Yeah.
3 to 5 times
Yeah.
or so.
yeah, but I don't think there's any magic number how many
Right.
times you go back and forth, but work your hands while you're doing
Right.
it.
And if
Um,
you may not tolerate, maybe your hands feel better in the cold. Actually, my right hand feels good with cold.
Those are really
It's not
Interesting.
common, but I had a patient that way. She had an extremely bad knee arthritis, and she really liked cold packs. And like I said, it's not common.
Yeah, that's
but
not. Well, that's why we always leave it up to people because
Right.
it certainly doesn't hurt. What you can do is you can fill up the one sink and do the dishes in it,
there you
and
go.
then have the cold in the other one. So do the dishes for 5 minutes, then put your hand in the cold water, then go back and
Be
do the dishes.
productive.
Yeah, that's
There you
right.
go.
We're all busy people. We got to get things done while we're taking care of
Exactly.
our hands.
There you go.
So
Very good.
all right,
So
we salute you with our hands. So
good luck.
yeah, good luck.